We'll continue our discussion of the digestive systems, picking up with slide number 12, looking at the small intestine. When you think of the small intestine, this is where most of the activity of the digestive system is occurring in terms of what we look at as the major functions of the digestive system, and that is to absorb nutrients into the blood. So this is the largest area of absorption in the digestive tract. And we learned in lab the three different sections of the small intestine, the first part being the duodenum, which is what attaches to the stomach. And this is where the pancreatic duct and common bile duct secrete their contents from the liver and pancreas. And it is about 10 inches long, it's been estimated. And then the jejunum is this middle portion. This is the longest part of the small intestine. It's about 8 feet long. And then at the end of the small intestine is the ileum, which is the last portion before it takes the contents into the large intestine or the colon. So if we look at the small intestine, again, this is where most of the absorption into the blood occurs. We saw a little bit of absorption of protein that occurs in the stomach with the help of pepsinogen, but the rest of those digestive enzymes really act in the small intestine. So the different enzymes that we see are the disaccharidases, breaking down those more complex sugars, peptidases, breaking down proteins, nucleases, breaking down nucleic acids, lipases, breaking down fat. So when we look at digestive enzymes, remember that's an example of chemical digestion, where we're breaking apart the bonds of the more complex molecules and breaking them down into simpler molecules. For example, proteins are broken down into amino acids. Complex carbohydrates are broken down into those monosaccharides, such as glucose. So those digestive enzymes are very important in the small intestine. And if we look again at the cells that line the small intestine, we can see, first of all, that the lining of the small intestine comes up and down in this villi structure. These are finger-like structures that line the small intestine, and each villus is lined with simple columnar cells that also have finger-like extensions on their surface, which are called microvilli. We looked at these in the beginning of the semester when we studied the cell, and we talked about how their importance is for increasing the surface area of absorption for the cell. So these microvilli, we call the brush border, contain enzymes for breaking down substances inside the lumen of the small intestine. So those molecules then are absorbed into the simple columnar cells, and then from there they enter the blood and they're carried to the rest of the body, first passing through the cells of the liver. We'll talk more about that process in advanced A&P if you have to take that course. Also in the center of each villus in the small intestine is a lacteal. We talked a little bit about this with the lymphatic system, and this is an important structure for breaking down fat. So when fats are absorbed, they enter into the lacteal, and that's processed a little further before the molecules, fatty acids, and glycerol are released and used by the body. So again, the villi are found in the small intestine, and each cell lining a villus has microvilli to further increase the surface area and maximize absorption. Another important secretion of the small intestine is mucus. And remember that mucus helps to move our food along, keeps the food moist and traveling through the digestive tract, and it also is protective in nature because of the harsh acids from food and leaving the stomach. And the digestive enzymes can also start to digest the small intestine itself. This layer of mucus is very protective and prevents that from occurring. So when people have poor mucus production, and with aging, for example, they're more susceptible to ulcers because they lose that protective benefit from that mucus secretion. An accessory organ that we see associated with the digestive processes in the small intestine is the liver. Now the liver has many different functions. The number one function that you need to associate it with for the digestive system is making bile. So the liver's digestive function is to make the bile for breaking down fats. Underneath the liver is the gallbladder. It's a smaller organ, and its job is to store the bile. So we have the different hepatic ducts that drain the bile that's made from the liver, bringing it to the duodenum via the common bile duct. And then also there's a small duct coming from the gallbladder, which is called the cystic duct. That too brings stored bile to the duodenum when we eat a fatty meal. So lots of different functions for the liver. You can just kind of read the list, but the one that you really need to know of for the digestive system is bile production. So it helps produce bile to break down fats, and also part of that bile contains bilirubin, which we talked about is a breakdown product of our hemoglobin as our red blood cells age and are destroyed after about 3 months, 2 to 3 months in the bloodstream. So this is where if the liver is not functioning properly, the bilirubin can be built up in the blood and lead to the yellowing of the skin. So here's an example of jaundice of a person that has probably liver disorder, and the bilirubin is not being processed properly and showing yellowing in the whites of the eyes and a darkening yellowing of the skin. So the gallbladder, we said, only stores the bile. It doesn't make the bile, it's just stored. About 30% of the bile produced by the liver is stored in the gallbladder. So we do not need our gallbladder to survive, and some people who have swollen or inflamed gallbladder due to gallstones need to get that removed. Having a high-fat diet and lifelong obesity and being female are risk factors for having a gallbladder attack and needing your gallbladder removed. But some people have no risk factors and still have problems with the gallbladder and need to get it removed. So we can survive without it, and we just find that the liver just is more efficient at producing the bile if the gallbladder has been removed. Some people who undergo drastic dieting and lose a lot of weight, those fat cells are broken down, and that can cause cholesterol levels to build up in the blood briefly and promote the formation of gallstones. The pancreas is another accessory organ, which means food, just like the liver, does not pass through this organ. It only secretes and gives a secretion to promote digestion. And the major digestive secretion of the pancreas are the digestive enzymes. So there's special cells within the pancreas that specifically produce digestive enzymes. There's other cells in the pancreas that produce insulin and glucagon, but those are hormones that travel to the blood. So that's part of the endocrine system. When we talk about the digestive system function, making the digestive enzymes, these are not released to the blood. These are released to the lumen of the small intestine. So this is not going to the blood. That's why it's called an exocrine function. Another important secretion of the pancreas is pancreatic juice, and that is plays a large role in controlling the pH of the substances of the fluid contents of the small intestine. So that pancreatic juice and digestive enzymes are two important secretions of the pancreas. Then once our food has been mostly absorbed, the major nutrients that we need are absorbed, it enters the large intestine. So here is the end of the small intestine, the ileum, leading to the first part of the large intestine, which is the cecum. Recall that the appendix comes off of the cecum, and this can get filled with stool, leading to inflammation, and it can burst, leaking fecal contents into the abdominal cavity, and that's a serious infection which would require probably a hospital stay of a few days on some IV antibiotics. But the large intestine has a little bit of different, it's a little bit different in terms of the movements, the peristalsis that occurs. They're called mass movements. They're a little stronger contraction, moving more substances through. Being that the large intestine is, bigger in size, those movements are a little more, have a little more force behind them. And the main job of the large intestine is to absorb water, because a lot of fluid enters the digestive tract through what we eat and drink, and that helps propel it through the system. But by the time we get to the large intestine, we want to pull that fluid back and not lose that fluid, because we want to keep blood pressure up, keep the body well hydrated. So the job of the small intestine, as the stool enters into the cecum and goes up the ascending, across the transverse, down the descending, through the sigmoid and out the rectum, the job of the large intestine is to pull that water back to the blood. If a person has diarrhea, that's a dysfunctional process within the large intestine, and they're losing fluid that was meant to be absorbed back to the blood. So it's important, any patient or person with diarrhea, that they replace the fluid that they're losing in the diarrhea, because that can quickly lead to dehydration. And children are especially susceptible to dehydration. So it's really important with kids with diarrhea that we offer them small sips of fluid during like a stomach virus. And even popsicles are a good way to get kids to drink fluids who might have a little bit of an upset stomach or be a fussy eater. That's a great way to get fluid in at a slow rate that they'll tolerate. So when you look at the interior contents of the large intestine, on the ascending side, the contents of the stool are mostly liquid. As it moves across the colon, it becomes more and more solid. Where at the end of the colon here in the sigmoid is where most of the stool remains waiting for that reflex to begin for bowel movements and defecation, we call that. So the sigmoid colon is the most common location for tumors to develop. As the feces or stools sit and come in contact with the large intestinal wall, that can promote, irregular cell growth, contributing to colon cancer. So we find that high-fat, high-preservative diets increase the risk of colon cancer. So it's important that we get a lot of vegetables and roughage in our diet, and look for more wholesome foods, less processed foods, to lower our risk of colon cancer. There's also a significant genetic risk for colon cancer for families that tend to have more than one family member who develops colon cancer earlier in life. So the number one way to really screen for that is through the colonoscopy. And it's not a very comfortable procedure to prepare for. You have to take a medication, drink a pitcher of fluid that induces pretty severe diarrhea over several hours, and a lot of patients don't like that, so they put off having a colonoscopy. But it's really the most effective way for detecting any signs of early colon cancer before it would spread to the liver and become deadly. So the last part of the large intestine is the rectum. This is a muscular passageway that carries the stool out of the body through the anal canal and the anal sphincter. The anal sphincter, the external anal sphincter, is under our voluntary control, and we can determine when we want to have a bowel movement. Once that stimulus is there to have a bowel movement, we can control when that occurs through the external anal sphincter. So the different parts we talked about of the large intestine from beginning to end are listed here. And major secretion of the large intestine, now we talked about it absorbs water, but what it adds to the lumen, what it secretes to the lumen, number one is mucus. Mucus is the number one secretion of the large intestine, again helping that stool move through relatively, lowers the resistance of that stool moving through the large intestine. So mucus is an important secretion. And there's different electrolytes too that are reabsorbed in the colon, and one is bicarbonate. So bicarbonate ion is reabsorbed in the large intestine, and also sodium. So if someone has diarrhea, excessive diarrhea, they're losing that bicarbonate ion, and as a result of that, the blood can become acidic, and they can lose those important electrolytes. So bicarbonate and sodium can be lost through the digestive tract with excessive diarrhea. So it's important that we replace those electrolytes, if possible, to prevent dehydration and electrolyte imbalances. There's a lot of bacteria in the large intestine. Some are normal flora and are healthy. They help the digestive tract do its job efficiently. And then other bacteria can inhabit the large intestine that can cause trouble and lead to symptoms such as bloating, gas, constipation, or diarrhea. So for people that have trouble with that, they have what's called irritable bowel syndrome. Some probiotic, which is a bacteria that is healthy for the digestive tract and helps to keep the unhealthy bacteria at bay and keeps your digestive tract functioning. Too many of the unhealthy bacteria in the large intestine can cause extra gas production, which we call, the clinical term is flatus. It's normal for everybody to produce some flatus every day, but excessive flatus can be caused by certain foods broken down very efficiently by digestive enzymes. People that are lactose intolerant lack the enzyme for breaking down lactose, so when that reaches the small and large intestine, it causes a lot of gas production, a lot of discomfort. So those people take an oral enzyme in pill form. They buy it off the store shelf, and other dairy products. So there's these mass movements in the large intestine, and it's reflexes that control the movement of stool from the large intestine into the rectum. So the gastrocolic reflex occurs when the stomach is stretched as a result of eating a meal. And this is a really active reflex in children. If you've ever noticed, if you have young children or spend time with young children, about halfway through to the end of the meal, they already have to use the bathroom and have a bowel movement. That's because of that very active gastrocolic reflex. As the stomach is stretched, that stimulus acts on the large intestine, causing mass movements within the large intestine and promoting a bowel movement. The same thing occurs in the small intestine, the duodenocolic reflex. If it becomes stretched, as food enters, it stimulates the bowels to perform mass movements. And when that mass movement enters the rectum, that's when a person becomes aware of a bowel movement, and that too is a reflex acting on the rectum. So it's something that is under primary control of the parasympathetic nervous system. Remember, that's the rest and digest division of the autonomic nervous system. So when people suffer from constipation, usually it's because of high stress, inability to relax, low water intake, lack of exercise, because walking, exercise helps promote smooth muscle movement in the large intestine. So it's important with our patients that we're getting them up to walk after surgery, that we're giving them adequate fluid after surgery, and also providing some food choices or suggesting foods that are going to add a little fiber to their diet, because typical hospital food of like an omelet with a muffin and bacon is very low fiber, and it's going to contribute to constipation, which can really make patients uncomfortable. So here's just an example of some of the reflexes. Here's the duodenocolic reflex acting from the duodenum when it's stretched as digested food enters into it from the stomach, stimulating mass movements in the colon. Here's the gastrocolic reflex going when food stretches the stomach wall, again causing mass movements in the large intestine. So here's just a little description of what we just talked about. This is from your textbook. The external anal sphincter, like I said, is under our voluntary control, but we do have an internal anal sphincter that is not under our voluntary control, and that's what causes, when there's mass movements, causes that urge for the stool to leave the body. And depending on the ability of the person to control that external anal sphincter, that will determine if they are continent of stool. So young children under the age of 2 tend to have less control of the external anal sphincter. And as some people age, they lose control of that anal sphincter as well. So it's important that we be careful and with those patients and make sure they have access to the bathroom when they say they have to go. So as we age, what we find happening across the digestive tract is we lose the amount, are less efficient, I should say, in producing mucus throughout the digestive tract. So that puts us at higher risk for ulcers and stomach upset with certain foods. We are less tolerant of spicy foods, less tolerant of raw vegetables and those little bulkier foods. And the smooth muscle layer is less responsive, so we see it takes longer to digest food. People feel fuller, quicker. Constipation becomes more of an issue as food is not moved through the large intestine as efficiently, and we just don't break down the food as well as we used to. So as a result, people have more trouble with constipation or diarrhea, after eating certain foods. And because the immune system is not as effective either, throughout the body, food poisonings can be much more serious in the elderly, as well as poisonings, eating spoiled food, for example, that might be giving off a toxin that normally a younger person could tolerate. The elderly are more susceptible to complications related to that. So it's really important that we look and see what's in the refrigerators of our elderly relatives, making sure that they don't have expired milk or expired dressings or sauces, because with the sluggish nervous system in terms of smell and taste, sometimes they can't taste or smell food that is going spoiled, and they're going to put themselves at risk for food poisoning. Also, because of the decrease in the mucus layer and lifetime exposure to processed foods that increases the risk of certain cancers, like colon cancer. So we talked a little bit about constipation, talked about the taste and smell are less acute. We see more disease in the mouth. People are not quite as good at taking, providing good oral care. Sometimes if they have dentures, they don't feel the need to brush or to use mouthwash, and that can cause more trouble in the mouth. Diverticulosis is small little stretched out pockets within the large intestine, which can sometimes become trapped with stool and burst, leading to a perforated colon, which would be the same as like a ruptured appendix. That's very common among people as they age. Most people over the age of 70 have some diverticulosis, which again are those little weakened areas of the large intestine, little outpouchings, and that can become inflamed and filled with stool. So it's important for people to, see their doctor if they have any kind of, lower abdominal pain that doesn't resolve. That concludes our discussion of the digestive system.